Thank you so much for inviting me. I was invited to come along and to talk to you all about Worcestershire Children First, and that's always something I'm always pleased to do, to make sure that everybody knows who we are and what we do. So I put together a few slides which I hope gives you a real overview of who we are as a company and as a children's service of the council. So we move to our first slide. Maura, thank you. Okay, so Worcestershire Children First is a company. It's a wholly owned company of Worcestershire County Council, and we are responsible for the delivery of the children's services for Worcestershire County Council. And we were launched as a company on the 1st of October 2019. So we're in our second year of company now. We, as a company of the council, we have our business plan agreed not only by our company board but also by council, and our current plan was agreed in March 21 at Cabinet, and we have an external facing website, so anybody watching this will be able to go onto our website and have a look at the detail that's set out in our business plan. So thanks, Maura. So when I was thinking about sort of how to communicate what Worcestershire Children First do, I thought these were 4 key useful sort of points of reference. So at any one time, we work with about 20%, 20% of the population of Worcestershire are children. And so as a children's service, they're the children, that's our population size of children and young people that we work with. As a social care service, we are on average working with about 3,500 children at any one time. And through our special educational needs services, we're working with about 4,000 children who are subject to education, health and care plans at any one time as well. As a company, we're worth about 125 million. And that is roughly about 30% of the council's budget. And we employ about 1,000 staff. And if you look at that in terms of numbers over the staff of WCF and WCC, that's about 26%. So you can see from that as a company of the council, we are significant in size and proportion of who we work with and of the council. So if I move on to what we stand for, and you'll see in our business plan and on lots of our documents that we set out our vision, our mission and our values, and we have 4 key principles that we consider to be the foundations of our company. One is that children are at the heart of everything that we do. I'm sure people listening may have heard that back in 2016, we were an inadequate children's service. We had an Ofsted inspection that rated us as an inadequate service. And one of the things that we've needed to do from the beginning of our improvement journey is to make sure that as our services, we always understand the difference that we are making to the lives of the children that we're working with. And that's what we mean about children at the heart of everything we do. So the systems, the processes, the way we work, the culture of our approach, we always constantly come back to asking ourselves, so what difference is this making or has this made to the lives of children? And that's children really coming through the heart of everything that we do. Then we've got 3 other missions. One is that we value family life. So whilst we will be a social care service and lots of people will know us as the service that has children in care, actually it's really important that we've been communicating that we value family life, and family life starts with children in their own birth families. So as a service, our starting point is always to support parents, to support the parents to be the best parents that they can be, and to care for their children well and safely. And if children do need to come into care for their protection and safety, then we still value family life. we always look to see where we can support children to be cared for in a family care experience. That might be with the extended members of their own family, or it might be in a foster care family. But that valuing of family life is a real foundation for us in the way that we work with families, because we know that having that family experience is where children and young people get that sense of belonging and security, and we hope stability as well. So family life is our key value there. The next value you can see there is good education for all. So we have social care and we have education services and early help services in our company. And we know for all children that a good education, a solid, stable education is what helps them through childhood to achieve and certainly takes milestone steps into their own adulthood and adult lives. And that's obviously academically, that's really, really important. What you can achieve as an individual person academically is crucially important. But we also see and value education for its holistic offer of the things that children gain from education. So the social interactions and the support that they get through their education provision and through schools and other education providers. So that bigger, wider foundation of attendance and contribution to education is our second value. And our third one is protection from harm. So whilst we absolutely have those foundations of support, of valuing families, of engagement in families and families in the community, we are a child protection service as well. And so it is our duty and a responsibility to protect children from harm. So again, that's another area of the business you perhaps do hear more about when we need to respond to any concerns that we receive with regards to the welfare and safety of children. So there's no one of those values that sit in isolation. As a company, we keep those four values at the heart of everything that we do. And so our business plan, you will be able to see all of those things coming through in each aspect of work. So if I look at that, thanks Morag, in terms of the families that we work with, what you'll see is, I should have really just controlled this screen, it would have been better controlling. Do you want to just flip? That's great. So most commonly understood are those areas of neglect, physical abuse, sexual abuse and emotional harm. That's a well understood role and function of the types of work that a children's social care service do. But also we work a lot with domestic abuse between adults and within a family, and also substance misuse, both by adults and by children, and child sexual exploitation and general criminal exploitation of children and young people. All of those things are fundamental types of work that we do with children and young people and their parents. And as I say, they're probably the most commonly understood. But we also work with families where they also have financial problems, employment, debt, housing problems, poor mental health and emotional health and well-being of parents and children, parents who are themselves reliving sometimes childhood trauma that's impacting on their parenting of their own children, parents who are experiencing isolation or limited support as parents within their family, within their community. And we also work with families where there is parental separation. And sometimes that can look like child abuse allegations, and sometimes it can look like child trauma. So they are less commonly known features, but they are, again, all features of the types of work that we do with the children in the social care world of the company. If we look at it in operational terms, what that looks like is that for the social care and safeguarding side of our company, generally, as I say, we have about 3,500 children and young people open to services. On average, at any one time, about 600 children open to early help, 400 children open at any one time for an assessment, 800 or so children looked after, 300, nearly 400 children who are care leavers, and nearly 400 children who are children in need of support, and 500 subject to child protection, and 400 of children with disabilities. And the reason I've put those figures there is that although they change month to month, I wanted to just communicate that social care isn't all about having the predominant group of children who are all children who are open to either child protection or children looked after. You can see the range there of significant cohorts of children that we work with. And when we look at the education and early help sector within our company, we have about 243 schools and a range of other education provisions that provide that really valuable education. And we have a role with all of those providers to support them to provide that good quality education and their safeguarding elements of education as well. And within that group, we also have about 120 maintained schools that we continue to be accountable for. As a local authority, the Worcestershire County Council has responsibility for school sufficiency. And as I say, those educational outcomes and safeguarding measures. And as a company, we do that on behalf of the council. And then, as I said earlier, we have there 4,000 children who are open, who have an education, health and care plan. Now, they're not all open to children's social care at all and don't need to be, but we work with their education providers and our health partners, ensuring that those education, health and care plans are in place for those children and young people. So, as I said, we've had our company plan for 21-22 agreed by Cabinet back in March, and you can find that on the website. We've got a page on our plan where you'll see our company priorities. And our company priorities are set out in 3 sections. Firstly, there is the way that we are working in partnership with the council. And we have some key elements of work that we're doing in partnership with the council. We have the development of an all-age disability service, which is a 0 to 25 service bringing together our children with disability services, our SEND services, and our young adults team, which currently still sits within the council. We're looking at how we bring those services together so that we have better integration, coordination, and a long-term view in the way that we work with families for those children with disabilities that's taking place. The council have got a big piece of work this year on their digital strategy, and we're working closely with them to look at what we as a company can benefit and how we may develop our own systems and processes to benefit from those council developments. And really importantly, the integrated wellbeing. So the work of Here to Help that many of you will have heard about, that was developed and had real pace of development through COVID, where we can take that to the next step, that engagement with communities, the voluntary sector, to really ensure that families, the population of Worcestershire, but particularly for us, the families of Worcestershire also get that universal early help support when they need it. Our second strand of company priorities is how we as Worcestershire Children First are working together. So although this is our second year as a company, it's our first year where all of the services that are going to be in the company are now here this year. So we were joined by education, and throughout this year we've had some additional education services, we've had some additional early help services joining our company. So this for us, and of course in that first year as a brand new company, as you would imagine, that first year we had to make sure that we tried and tested all of those systems, processes, governance. Those things needed to really start to be embedded. So for us, this is a really exciting second year where we can really start to pull together how we work as a company across those 4 visions that I set out at the beginning. So what we've got is some commissioning functions in different elements of the service, and we're looking at how we can bring those together to make sure that we always get best value in our commissioning and good outcomes for children in any services that we commission. We have got a quality assurance programme, and the quality assurance for us has 3 elements. It has our key performance indicators, but it also has our audit activity that looks at the quality of practice, and really importantly, it's the 3rd element, which is the voice of our service user. So the voice of our children and young people. What are they telling us about the difference we're making to their lives? And so for everything that we do within children's social care, we've had a quality assurance approach, those 3 things. And as a company, we are now making sure that we have that quality assurance approach across everything that we do as a company as well. And then our 3rd element there as a company is our workforce. And as it says, our workforce is absolutely our foundation. And we need to make sure that we go forward as a company, sustaining the excellent positive improvements that we have made. We sustain those and still improve more and develop our services even more. So whilst that sets out our company priorities, what you will also see, and that sets it out as a plan on a page, because that's always nice and colourful and an easy way to communicate that. So that's what I've just gone through. If I go down to the next slide, what we will also see, in the next slide, Maura, thank you, is our structure there of children's social care and safeguarding structure. And again, you can see this on the website, and that will give you our key managers and information about how to access all their managers. And the next slide gives you a similar structure for our education and early help services. So again, you can get this on our website, and you can see where the managers are and how to access it. It just gives you a feel as well for the size of the structure of the organisation. But within our business plan, on the next slide, what you'll see is that we have a business plan that again is set out simply as a plan on a page, one for the social care and safeguarding directorate, and a separate one for our education and early help services. And you can see there that this is the social care and safeguarding priorities, where we have early help and children in need, and the work that we are going to be prioritising this year, how we are supporting those children in need, developing multidisciplinary ways of working with those children. So if I go back to what I was saying earlier about those different aspects of supporting parents, mental health, substance misuse, financial problems, relationship problems, supporting them to be the best parents is what we're really focusing on, and doing that at that first intervention of children in need. Early help, making sure that even before children in need, families in the community know where to get access to early help that is effective early help for them. Get safe. I hope everybody listening today knows what I mean about Get Safe, but if you don't, I would ask you strongly to Google Get Safe, to look at our website. This week actually is the 2nd year of our Get Safe launch. Get Safe is the Worcestershire Children First umbrella term for exploitation. So for children who are experiencing exploitation, and whether that's sexual exploitation or trafficking, you'll find information and guidance on what support services are out there, what to look for, who to refer to, how to get support. And so that's a real key priority for us every year, to make sure that we are communicating to our partners, to professionals, but also to parents, families and members of the community. What is Get Safe? How can you identify it? And really importantly, if you do identify those types of concerns for children and young people, where can you go to get some information and support about what to do next? And then the last one there is the Positive Outcomes Project, which is about our students. So student social workers This is about us making sure that we are thinking about our workforce of the future, and also making sure that we have got as much capacity to support families early as well. So we have lots of students within our services as well. And then we look at children in need of protection. So the first two elements there, the Worcestershire Safeguarding Families Project and the Pause Project, are both innovative projects that we are launching this year, which are specifically targeted at parental capacity, supporting parents to care for their children well, and preventing the need for us to move into care proceedings, and ultimately reducing the need for us to remove children from care in order to safeguard them. What we want, as I've said, is to support parents to be able to safely care for their own children. And there's two projects there that are specifically looking at those areas of work. We know domestic abuse continues to be a priority. It has been for a while, and with COVID and the additional pressures that COVID and lockdown and family pressures have brought on families, domestic abuse continues to be a key priority to look at identifying and offering support. So that remains one of our key priorities within our business plan under the child protection arm of our work. And then timeliness and sustainability and permanency. So when we have children coming into care, it's really important for us that they don't have to stay in the care system and in those unstable placements, not really knowing what's happening to them in long-term care for as short a time as possible. So what can we do to make sure that we can support children to move into long-term stable fostering or adoption or special guardianship arrangements? All of those things are priorities for us, for those children who are experiencing child protection. And then, as you might imagine, we've got children looked after and care leavers. These are a hugely important cohort of children and young people for us. Those are the ones that we are corporate parents for. And within our priorities going forward, as you might imagine, the sufficiency of our placements, making sure that when children do come into the care system, we can support them to have the right placement that gives them that care and stability as they move through the care system is really important. Therein you can see their foster care, transitions for children leaving care into semi-independent support and housing for care leavers, and also developing the quality and the purpose of our residential care are the three elements in our sufficiency. Emotional health and well-being for children who are in care and care leavers. I know Jo talked about earlier, and you will have heard about the work of Health Watch, recognising that health and well-being for all children is of fundamental importance, particularly as our children and young people in Worcestershire have experienced COVID. But as you can imagine as well, for children in care who have got the additional breakdown, separation, and experiences of abuse and trauma in their lives, that emotional health and well-being is even more important and the top of our agenda to make sure that those children have access to those services and that those services are making a difference to them. And then we have a number of children who are in residential care, and not all of them are in residential care that are in our care. So it's important for us that these are children who are in our schools, that are in our services, but they are children in care of other local authorities. And we need to make those connections with their residential providers in Worcestershire to make sure that those children are safe within our area. And that will link back into that Get Safe agenda around criminal exploitation, gangs, etc. And then the fourth element of our priority plan for this Children's Social Care and Safeguarding Directorate is that knowing ourselves and knowing the impact that we are making to the lives of children. And it just really sets out there the different mechanisms. We've got our own quality assurance programme, as I've described, but then we also have a range of independent mechanisms that take place, whether it be through Ofsted or through our safeguarding inspections that take place, that help us to know ourselves well and look at the quality that we're delivering. So that in a nutshell on that plan of the page is what we're doing in terms of social care and safeguarding. And the next slide will take you through what we're doing in terms of education and early help priorities. So people may have heard about the development of the new Worcester City secondary school, part of our sufficiency to make sure that we are providing enough education placements for children at the right age groups. There are two key priorities there. And school place planning, so the three priorities there, working with the education providers. And also early years, the place sufficiency for early years and that network of early years provision for young children, both working within the private and the community voluntary sector. The quality of education provision, as I've said, we have lots of academies, but we also have maintained schools, but ultimately these are education providers, and there's some links there on what we do to support them in terms of the COVID recovery curriculum, in terms of that support to them for safeguarding and ultimately education outcomes for children. But you can also see there the support priorities within the business plan around the Small Schools Project, supporting them, and governor recruitment and training. Those are the issues that have been identified as key areas that we need to support the education providers on this coming year. And our early years strategy, really making sure that we are developing that plan and putting in place and supporting those early years providers to give, again, that safe quality early years provision, and linking it then into the pathway into education services. SEND and vulnerable learners is another priority within our education sector. But as I say, these are also issues that we're developing cross-service, so social care and safeguarding, and making sure that they are fundamentally and heavily involved in the SEND strategy and the SEND improvement plan. But we've been working on a SEND improvement plan for 2 years now, and we are expecting imminently our Ofsted review of the progress that we've made against that plan. Another priority within this area of our business is the high needs management plan, and making sure that we are getting best value for money for as many children as we can. And that part of the plan is working with education providers, but it's also working with the DFE and government, as well as within the region in terms of best practice. Our vulnerable learners, so those are children who are missing in education, children who are at risk of exclusion, and supporting parents who are educating their children at home, making sure that they have got the right information and access to support that they should have to make sure that they're able to provide that good quality education for their children too. And we have a vulnerable learners strategy as a priority this year, which is looking at as just those things, as I've said, the virtual school development, the medical education provision for those children who, because of their health needs, are not able to attend their mainstream school, and also those children and people who are at risk of or who have experienced exclusions. And then we have some work on integrated business systems. When we look at our early help, the Troubled Families Programme, the implementation of early help, and as I've said, we want to make sure as a company that we're working with the council, with the voluntary sector, and with the communities to make sure that families do get early help, and that we don't have to wait until there's a crisis and families have to come into the social care level 3 area of need to access early help. We want to, as part of our work with Worcestershire County Council and the district councils, it's really important to us to understand what that early help offer is, and that's through, as I said earlier, the integrated wellbeing offer, the development of Here to Help. And we will do that through our Children and Young People's Plan. So it's not just children that are open to the Children's Social Care, Worcestershire Children First, but the whole complement of children and young people that live within Worcestershire. And then, as I've said, the development there around the knowing ourselves well, always asking ourselves, what difference are we making? How do we know we're delivering quality services? And that's the development of our quality assurance programme across our education side of the business. So I feel like I've spoken really quickly as well as Jo. But the last slide really just takes you through, as Jo said at the beginning, we work with Healthwatch in a range of forums, through council scrutiny, through the Health and Wellbeing Board, through our Children and People strategic partnership, but also linked in terms of our safeguarding partnership and any specific work streams that we have where we cross over. Really pleased to have received the recent report on emotional health and wellbeing from Healthwatch. Really pleased about how many children and people you managed to reach the view of, and so we've looked carefully at how we've considered the recommendations from that report, and I know that through the coming year there'll be a range of other things that we can work closely on together as well. And I wouldn't be able to finish a presentation to any group really without just raising the need with regards to the ability for anybody to be part of our work in potentially becoming a foster carer or an adoptive carer. These are both areas of our business where we're always looking to identify people who think that they can add value in a different way to the lives of children by being either a permanent carer or a short-term carer. Please, you have this slide, so do get in touch if you're interested in any of those services there at all. So that was absolutely a whistle-stop tour to what is a huge, complex company, but happy now to join the rest of the panel, I think there is, to see if anybody's got any questions or comments that help us to talk about.
Thank you very much, Tina, for a very interesting and informative presentation. It was great. Yes, we do have some questions. Jane, did you have?
Yes, thank you, Tina, for a really interesting presentation. And you alluded to our recent COVID reports, which identified the adverse effect on children and young people's emotional health and well-being during the pandemic and continues. And obviously it's part of the planning, but have you got any specific examples of how you plan to develop service to meet this obviously very much identified increased need, in the years going forward?
Oh, you're on mute, Tina.
Okay, specifically in terms of health and well-being?
Emotional health and well-being, yes, certainly, and mental health as well.
So working with the health providers, talking to children and people to find out what services they are accessing, what services they're not accessing, why they're not accessing, and we do that through talking to the children that we work with as part of our assessments, feeding that back into the development of those services. We're developing pathways for children who are in our care, including care leavers, so that we're working alongside health so that children know where to go, professionals know where to go, and we can also unblock blockages in the system where we're not being able to give children and people timely access. That's one of the things that has been a concern. But I think fundamentally it's making sure that we are measuring the difference that those services are making. I think that's the big piece of development for us going forward. And we do that by asking children, making sure that they're getting those services, but then asking them all the time, how is this making a difference? And asking those that are caring for them or working with them, how those services are making a difference as well. And I think through our early help partnership and our Children and People strategic partnership, both of those making sure that health and wellbeing board, that health and wellbeing question, and what is the provision and what's the difference it's making is always out there. Is the way that we are making sure that we're developing services going forward.
Thank you.
I was just also reading the question on chat there, how do you encourage families about their experiences? So what we have is at the end of every assessment, we go out and ask children, young people and parents specific questions around a survey. Have you felt engaged? Did you feel that you were able to share your views? Did you feel your views were taken into account? There's a set of questions that we ask at the point of closure of every assessment, and again at the point of closure of every case. We also have a programme of case auditing. So each month we will audit 30-40 cases across the service, and as part of that audit there are 5 elements. One will look at management, oversight and supervision of social workers. One will look at how the voice of the child is represented in the case file, to see if we can see the conversations that have taken place. But we also contact the child, the young person and the parent as part of that audit as well, and we build that in. We ask children in placements for the foster carers' annual reviews. We go to them and ask them how they're experiencing those placements. We ask children when they have left placements, how they've experienced the placement. We have an IRO for every child looked after, and we have child protection chairs for those children that are subject to child protection. They do what we call midway reviews, where they call those children, young people, and we ask them, how easy has it been to get hold of your social worker? Do you feel that you get the opportunity to talk to your social worker? Do you understand why you're on a child protection plan? Do you understand what your childcare plan is seeking to achieve? So there's a whole range of questions that we ask throughout the work. I mean, there's many more, but it just gives you that we have a program of work that we do on a monthly and pull together the outcomes of those on a quarterly basis. So that's all in addition to the one-to-one direct work that a social worker or a social care worker will do with a child on every assessment and every plan. So we do that case by case always, but then we will do all these additional things at different aspects and different times throughout the piece of intervention that we're having with any child or family. And that's how we get to understand how children and people are experiencing our services and the difference that we're making. And last year we developed what we call the Webster, and so it's a tool where there are key questions. How healthy do you feel? How safe do you feel? How engaged with your community do you feel? How do you feel about your friendships and isolation? And it's a graded question. So children and people will be asked on a rating scale of 0 to 10, how safe do you feel? And they'll give us a number, and we'll talk them about, if they've picked number 3, why have you picked number 3? What is it that makes you feel safe to pick number 3? What is it makes you feel unsafe? Why are you not picking number 4, 5, 6, 7, 10 being the highest? We do that at the beginning of an intervention, and then we do it midway, and then we do it at the end of an intervention. And that way it gives us focused conversation on those range of factors with each child and young person for that individual piece of work. But as a service, we could also then pull that data so we can know that of 50 children that we've worked with where we've done that second Webster questions, we can see that we have increased how safe children feel, or we have increased how healthy they feel, or and that's what the Webster means. And so we've implemented that in our Edge of Care services and our Children in Need services, and through this year we'll be implementing that Webster through more and more services that we're working in. So we're always looking at new ways to, as I say, to really capture and give lots and lots of opportunity to understand the added value that we're bringing to the lives of children.
Thank you.
Thank you. I think the same questioner asked a follow-on question, which was, does this also apply to education services? Yeah.
So the priority and that business plan, so this quality assurance framework and that way of working is something that we've been doing as part of the social care improvement programme, which has been in place now since 2017, as most people will know. And actually, when we were re-inspected in 2019 and we came out of being an inadequate service, It was one of our strengths that Ofsted identified. So we've had longer in the social care world to really embed that as, embed, I suppose I've used the word already, really embed that across our services. So it's not just the day-to-day casework with children, it's the add-on that we're doing. Now in SEND services and education services, that day-to-day casework, they do that, and they have started very much, we've started very much to build that auditing of casework to look at the quality. We have just, Sarah, most people will know that Sarah Wilkins, who's our Director of Education, we have just signed off the quality assurance plan for our education service, SEND and education services. So we are strengthening those three, the KPIs, the audit activity, but the service user feedback, and really looking to expand the different times above and beyond the day-to-day casework, expand the times and places and ways in which we go out to children and people and ask, what difference did we make? I assume it also includes youth workers and the services they provide. So, we have some youth workers within the company, but the youth services provision is held within, public health is held within the council, but we do have youth workers and outreach workers within our Strengthening Families First service.
Very much. Martin, you did have your hand up at one point. Has Tina already answered your question, or did you have a question you wanted to ask? Ooh.
Sorry, are you talking to me?
Yes, you'd had your hand up at one point.
I'm sorry, if I did, it was a mistake. Beg your pardon.
That's okay. Simon, did you say that you had a question for Tina?
I had my hand up. I think it was me.
Oh, it was you. It was
yeah, I was actually going to bring in the question from the chat, but Tina got there before us.
Sorry.
No, that's fine. That's good. That's good. I suppose, I guess the overriding question is, I mean, I think Worcestershire Children's First fell out of the Ofsted inspection regime, didn't it? Is that right? It was a response to that.
Sorry, say that again. I missed that.
Worcestershire Children's First as an organisation.
Yes.
Fell out of.
Yes, yeah. So when we, sorry, I didn't go into the history at the beginning, did I? So when we were judged to be an inadequate authority in 2016, as part of that, the council were appointed a commissioner by the Secretary of State, and the commissioner did a report that said that actually Worcestershire County Council has to deliver its services by an alternative delivery model. And there were a whole range. In fact, there were 16 different models that we looked at in terms of the ways that we could deliver services that were not delivered by the council fundamentally. And actually, we came up with this model, which is a wholly owned company of the council. So we are a company in our own right. And as I say, we launched in October 19. We have our own board, we have our own chair, we have our own non-executive directors, and we have our own directors as a company. But we are a company that is owned by the council. So we also have a contract with the council where they hold us to account for our performance, for our outcomes on finance, and for our key performance indicators as well. So the relationship between ourselves and the council, it couldn't be more important to make things work. And we have made it work very, very well, and we're really pleased with how things are going. So we are able as a company to have a pure focus on children and young people, and that's been really helpful for us to do. But we also work really closely alongside the council on anything that they are doing that may or could improve things for children and families, which is why I was saying at the beginning that part of our business plan, that one work stream in our business plan, is we've looked across at what's happening in the council, and we've identified the key things that we want to footprint in, we want to voice in, and the council will do the same with us. They will look at what we're doing, and they will talk to us about things that they want to understand what we're developing and how, and work with us on that as well. So we work very, very closely, but yes, the the council was required by the Secretary of State to deliver its services not as a council, a normal directorate, but in an alternative model, and that's what this Worcestershire Children First is.
Yeah, and I guess you'll forgive us as lay people for looking at it and saying, well, actually, the council's approving your budget, the council's actually approving your business plan. Fundamentally what has changed, but more importantly, what's been the impact, the changes for children and young people, I guess, and families. And you've talked a lot about your quality governance framework, but what's the sort of highlights of the improvements, if you like, that you've made?
Well, we were re-inspected in July 19, and at that point we were inspected by Ofsted to say that we were no longer an inadequate authority service, children's service. We were requires improvement to be good, and anyone can read that report, and you will read that it was a very, very positive report. Actually, that was before we had moved into company. But
yeah,
actually, we were the first. We were the first local authority under a direction to have achieved that improvement and to have achieved that grading. No other local authority has managed to do that. So, you know, what that tells you is that actually is really important in terms of it doesn't matter what model you're delivering. It's about your leadership. It's about your quality of services. It's about your staff. So that does say that. But actually, since we've been in a company, we do have our own board. We are able to use that board and our independence to tell the council what we want to do and how we think things need to work for us to prioritise children. And the council listened to that. So yes, they approve our budget, and yes, they approve our plan. But I feel that by having a board behind us, we do have an independent view and case that we put to the council, and that has worked well for us.
Okay, I've got one more question, Jo, if I can.
Yep.
Right, and
that was like, on the.
There's two from the public as well, Simon.
Okay, are you going to dealing with the board questions first and then go to the public?
Yeah. Okay.
The only reason I put my hand up was it was a relevant question to what Jane answered.
Yeah. Okay.
Yeah.
Well,
and I'm sure the public will want to know what we do to actually, forgive me using the term, Tina, hold into account, but that's the term that most people understand rather than the complicated local health watch definition of it. But one of the things that interested me was I've been on your website in preparation for this, and Jo mentioned our advice and information service we provide. If somebody calls us and wants to has a concern, I won't say a complaint, but a concern about your services or even a compliment, I mean, where do we direct them to? Because I couldn't find on your website you know, either a policy of practice around how to, or not very easily, I couldn't find it, how to actually express a concern.
Oh, well, it's a concern that you couldn't find it easily. So I'll go.
I couldn't find a search. Actually, I couldn't find a search tool on the website. So
I'll go back and make sure.
I'll just have a look at that. But presumably we direct them to you and not to the council.
Yes. Yes.
Yeah.
Yeah.
Okay, that's answered the question then. Thank you, Jo.
Thank you, Simon. John, did you have a question?
Thank you. Hi, Tina.
Hi.
It was just, I think you've touched on it, but I just wanted to ask if you could give a little bit more detail around co-production and the model of quality assurance you use. I think you said there were 3 elements of that, particularly the voice of the child and the families. How do you make sure that those work effectively for people?
So we have the framework of our quality assurance, which is those 3 elements. So one is our key performance indicators, and key performance indicators are very valuable, but they do just give you a data and a headline, but they tell you a story. They give you the headline of information that you might want to deep dive into, and so they're a useful monitoring tool. I don't see them in KPIs individually either. I do see them as a collective. So KPIs are important for that. But sat on their own, they're not going to tell you enough detail about what's happening. They don't give you the quality and they don't give you the experience. They often give you the demand and the timeliness. So that's what we get a lot from KPIs. So that's why we've added our audit activity, because the audit is where you get the experience of the quality. So if you've got people auditing activity, and the way that we do audit is we call it looped audit. So we will select cases where we have two managers, quite separately and independently. They will go and audit a case against an audit tool, and there are 5 dimensions of that audit tool, for example, which will be, what does the management oversight look like? What does the partnership working look like? What can you see in this case file when you look at it? Can you see communications with partners? Can you see meetings taking place and good attendance of partners? So that's just one element. And within that, the voice of the child is one of those elements. So it will say, can you see the recordings here of where the worker has spoken to the child, that case recording of what they've said, how they've said it. Can you see minutes of meetings that have been sent out in child language, for example? So we look at those 5 domains, and those 2 managers look at that separately and they grade it. Then they come together, and we have then a 3rd manager, a senior manager, that comes together to say, well, let's look at, and that's called the moderation. So then they will look at, did you grade this the same? And we have practice standards that sit behind what if you're going to grade it inadequate, adequate, good, or outstanding. We have a criteria around that we use from an Ofsted tool. So the 2 managers and the 3rd manager that's moderating will come together and say, actually, yeah, we can see that you've graded this similarly, or we can see and ask the questions, well, somebody graded this higher or lower, and let's talk about that. So we get the information of the auditing tools, but we also get continuous learning of all of our managers involved in that process. And we found that really, really helpful. And then the 3rd element, as I say, is the voice of the service user. So that can be the child, the young person, or indeed the parent or the carer. So within that, when we do those case file audits, one of those auditors will also call the parent and talk to them and say, I'm auditing this case. Can you tell me how you feel? I can see that there's a recording here of, what the social worker's conversation with the parent, but I'd like to hear from you. Can you tell me? Yeah. So there's an added opportunity for a parent or a young person to do that. And then outside of the case file audits, as I say, at different parts of the intervention, we will also go back to children and young people. So at the end of a social work assessment, or when we're about to close a case, we will have somebody that will ring a parent or a carer or a child and talk to them about, well, you're about to close your case. How did you feel your experience of the service was? And then sometimes, going back to our KPIs, we may identify something that we think, the timeliness isn't looking so good on that, or it's done really well, or we've got an increase in demand in that area. We might then do a specific task and finish piece of work where we design an audit tool, a survey perhaps, and we'll send that out then to children, young people. And then, of course, we've got all the things that you might imagine, like our children in care groups for young children and older children, our care leavers participation groups. Those things that are fundamental as well to practice. So we have a huge range of opportunities and mechanisms for understanding the quality, the timeliness and the experience. And that's what I mean by our quality assurance programme.
And could I just link that with your co-production? How does that work in practice?
So if we're developing something new as a service, the same element, we will be looking at how are we going to develop this, what should it look like, how will we measure what it's going to look like in the future. What will be its KPIs? What will be, how will we audit it? What will its practice standards be like? And how will we know that what we have developed or what we're developing is going to be a positive experience for children and families? And so we apply those three elements at the very beginning, and we engage in those processes right from the beginning. So you'll see in our business plan, against each priority, we will have the mechanisms for asking children, young people, or parents or carers, the mechanisms for an outcome measure, and our audit as we are developing those priorities. How are we achieving against these priorities? So each time we're developing either a new service or we are focusing on improving part of our service, we will have those three key elements that run through the development or that piece of work that's taking place.
Great. Thank you very much.
I think, Martin, you have got your hand up now.
Yes. I wondered if you were seeing or anticipating an upsurge in demand, and if so, do you believe you have the resources to meet that?
We have had an increase in demand. We've had a huge increase in demand from the beginning of COVID, really, pretty much from April, May, at our front door. What we found is that demand throughout that year, the last year, has been a demand for early help services. A lot of that has been about children, young people, families, not knowing where to access early help. During COVID, what we know is that families weren't sure what was open, what wasn't open. It became more difficult to access services as we were in elements of lockdown. What we took from the rise in demand from a safeguarding perspective is that at least people knew to contact the front door, which was good, because that we were able to then direct them to services that were open, even if they were accessing them online for a period of time. But actually that demand has remained high, and this is really important, which is why it's in our priority plans to make sure, both through the Safeguarding Board and through our own business plans, and through the work with the council, that's why it's a priority in all of those three work streams, to make sure that that early help offer, the accessibility of it and the effectiveness of it is there in the communities, and that actually professionals and families are not reliant upon waiting until things are very difficult, or because they don't know where to go, just going to the front door of social care. We want to make sure that across Worcestershire, early help is understood and the offer is out there and accessible and making a difference through districts, through communities, to local people where they live. And that's why it's a priority across those three areas of work streams. We've had periods, as you might imagine, when the schools have returned, where we have peaks where the schools have identified children coming back into the school system. I don't think and then that's calmed down a little bit. I don't think we have really seen that peak in demand yet around the hidden harm agenda. Just because schools are open and children are back in school doesn't mean necessarily that children are going to go back into school and talk about problems or worries that they've had during this last 12 months. Now that children are more in contact with their extended family and friends, it doesn't mean they're going to go and launch immediately into a conversation. Children need trusted relationships in school and within their extended family and friends network. And for me, I think children are having to go through the process of re-establishing those trusted relationships where they have not been there for them consistently for a long time. Their grandparents, their aunties, their friends, and as I say, their teachers and their staff at schools. So schools went back, schools have been open for vulnerable children, but schools properly went back in March. And we're only a couple of months into that, and then before long now schools will be closing again for the summer. And I think realistically, in September, October, November, December, when children have got feeling back in the routine, they're back in touch with extended family and friends. And this is all based on, you know, we don't know what the next waves and you know, lockdown may or may not look like through the winter. We've got to keep working with the situation as it presents. But I do think that I know the demand has risen. I know it hasn't yet reduced. I know that lots of the demand that's coming through is about early help, pressures on families, finance pressures, emotional health and well-being pressures. We have got to get the early help offer out there fast to families. But I do think we have got in children's social care safeguarding services another wave of demand that will come through, but I think that will come through later in the year. Are we prepared for that? We are as prepared as we can be. The answer isn't to just have more social workers, more staff. The answer for me is that we get the early help offer right, and also that we have multidisciplinary roles that are supporting families. And so when I was describing to you having those multidisciplinary roles like outreachers, youth workers, emotional health and well-being workers, adult mental health workers within our systems, within social care, as well as separately out there within health services, all of those things are necessary to be part of the system within which families live, so that we're all not working with the same families, we're all working with different families to try and make sure that they get the services that they need early on. I don't know if that helps.
Thank you.
Is that okay? I'm also trying to read down the chat.
Yeah.
I'll just have a quick read down the chat. I said the one about youth workers. Thank you. How are youth services integrated with children first? They should not be out on a limb with a safeguarding remit. So I don't see youth services as out on a limb. Just because they are commissioned within public health, as I've just said. You know, it's important that we have youth services that are part of the universal services within the voluntary sector, out in communities, out in districts, because we have children who are part of the Worcestershire population and they need youth services. Youth services are help and support. We shouldn't have children only able to access early help and support if they come into the remit of social care and safeguarding. So it is important actually that those services do exist within public health remit responsibility out in the communities. Within that though, we do have some roles of youth workers within our social care world too, as I've described in terms of that strengthening families first. And the Get Safe agenda isn't a social care agenda. The Get Safe agenda is absolutely firmly launched across all the levels of need. And when I say the levels of need, I'm sure most of you will have heard of thresholds, levels of need, it's called in Worcestershire, that universal level. Level 1, where the family might need a little bit more help and support. Level 2, where perhaps 2 or 3 services need to get together to make sure they're coordinated in supporting a family. Level 3, potentially edge of care, edge of child protection, moving into children in need. So let's make sure those the multidisciplinary way of targeting that parental capacity to help those parents get it right first, well before you move into level 4. Level 4 being child protection, safeguarding. So there's so much that we need to do before those families hit that level 4 need. And the reason we need to get all of that done first is because we don't want children to have to experience significant harm at that level 4 before we offer them the support. We want to reduce the number of children experiencing that level of harm. And that means helping them at universal, at level 1, at level 2, and at level 3. And Get Safe does exactly that. It looks at identifying and connecting and working with families in the districts, within their families, in the communities, through the voluntary sector, as well as a number of services that we've also got perhaps jointly commissioned with the PCC or the Public Health Commission that support children and young people, or sometimes the district's safeguarding partnerships are also commissioning outreach Get Safe workers to do that very support, identifying risks and connecting children and young people to that universal offer before they're experiencing that level 4 safeguarding harm. Do you tell us what arrangements are in place for young people in transition to adult services? We have the young adults team, and we're developing, as part of the priority, is the development of the all age disability services. So the young adults team, who currently work with those children and young people 16 plus. What we know is that we try to work closely. Obviously, children's services have always worked closely with the young adults team, but actually we think we can do it better, which is why the primary piece of work between the council and ourselves as a company is that all age disability programme. So bringing children with disability services, SEND services and young adult services together, so that we are minimising the duplication of roles, maximising on resources, having an outcome focused thinking and long-term outcome focused thinking, so that you're not just in a children's service thinking, what are the achievements, what do we want to see as an outcome for this young person when they're 18 or 19, but actually thinking, what do this young person when they are an adult, as they move into full adulthood. And that's what we're trying to achieve within our all age disability work. The challenges with that are that it's a huge piece of work and it's a complex agenda. We need to bring our partners on board in that. Our health partners and our educational providers are absolutely fundamental to that work and getting that right. Getting all of those collective agencies to work at the same pace is a challenge when there's so many different agendas and so many different demands competing on their resources and on their time. But I would say what's successful is we have got a really good leadership group around the table, from health, from the provider and the commissioner in health, through the CCGs and the Trust, through Worcestershire Children's First, through Worcestershire County Council, through Adults People Directorate. I think we've got a really strong leadership where we know where we're going. We've got lots of engagement of parents, carers and staff through various different work streams. And I think we are really building what we want to do and achieving that well, and using, as I've just described before, you know, that those principles around asking children, young people, parents what it should look like all the time, and staff. How do you work now? What are the challenges that you get now? How could we make your day-to-day life as a staff member easier? But also looking at what will our outcome measures be, not just at the end of the programme, but as we're developing the programme. What will our KPI headlines be throughout the programme, to give us those quick headline indicators to make sure that we know whether we are heading in the right direction or whether things are problematic for us. So that's some headline challenges and successes. Wondered about the co-production to develop services rather than case audit. So I think I've talked about that in terms of,
I think you have, yeah,
bringing people at the beginning. Read about personal assistance for care leavers at age 17. Seems like a good idea. Yes, that's exactly what we do. We have personal advisors, they're called personal advisors, PAs, we, in fact, last year, part of our business plan last year was to bring our outreach workers and our personal advisors together under one service. So we knew that we were duplicating roles there for young people. They were explaining the same thing twice, and we've got a very similar function. So we've brought those services together, taken the best from both. So yes, all of our children, young people in care have a personal advisor at 17. How about listening to people ideas generation? I'm not sure what that means. how about listening to people, ideas, generation? I don't know what that means. Is that people, ideas, generation? We have lots of participation with young people, if that's what that means. I think I've described that earlier, both through our care leavers groups and our children in care groups as well. We have actually also in the process now of appointing a specific young people's participation officer to work not just across children's in care and care leavers, but to work across children in need and child protection. So always looking at ways to talk to children and people. I think that's one of the things I was saying earlier about the Health Watch report. I was really impressed with how many children's voices you've reached out to. So I think I've said both to Simon and yourself, Jane, you know, really keen to tap into some of the surveys and things that you can do for us. The schools do some excellent surveys with children and young people, as do health and CCG. So, you know, having talks around, if you're going to do a survey anyway, can we badge into that? Can we add some questions into that so that we can do that jointly? Is definitely something we're doing. Safe spaces at school with counsellors available. I think schools are very conscious of making sure that they have got safe spaces for school support staff, whether they be counsellors, whether they be mentors, for children and people to talk confidentially. I think schools do provide that. Certainly schools I'm aware of are very do that well. They know, they build that into their school provisions and placements where they can. We had through COVID, we had a back to school project. One of the learnings from the back to school project was peer mentors and having young people talk to other young people about the challenges that they were having in going to school, engaging in friendships, academic challenges, all of those things. Our safeguarding lead is leading on that with the Solihull sixth form to implement that across schools and the learning from that, because that was a really positive piece of work we did in that back to school project, which you can read about in our business plan. Most young people with SEND do not meet the criteria for the young adults team, and so we are looking at so when we talk about criteria, we're looking at outcomes. We need to be having the outcome conversation rather than being fixed on who meets what team service. There are a number of mechanisms by which we can assess children's needs and by which support provisions and services can be put in place to meet children and young people's needs. And it can't always be about, you have to have a social worker or you have to have a specific type of assessment. We know the demand is great, so we have to make sure that there are a range of ways in which we can identify needs, assess needs, and then put provision in place to support needs. That has to be accessible and proportionate, rather than every child needs to be in this particular single service or single team. And that's part of the work we're doing, not just within the all age disability, but across children's social care, as I've just described as well, around that universal offer, that level 1 and level 2. Otherwise, we'll only develop services at level 4, and we'll be waiting for all children and families to have to experience that very high level need before they actually get any services. And that can't be right for the experience of children and young people in their own family. We have to get that right at a much earlier level. And shall I just take this one? Many families describe the transition as falling off a cliff. That's absolutely right. Many families do describe that, and that has been key to our all age disability development in particular. We don't want it to feel like falling off a cliff. Sometimes moving from one service to another can feel like falling off a cliff. So we won't have that in terms of moving from one service to another, but there will be at some point, it may not be 19, but it will be at 25. At 25, you won't be open to the children's all age disability service, but we don't want it to feel like falling off a cliff. It will feel like you have transitioned into the adult world of services. And that's why we need to be having the outcome conversation, not the criteria conversation. Which team can you fit into? What outcome are we trying to achieve for this young person or this young adult, and who is best to support them to achieve that outcome? That's how we are approaching, not people not feeling like they're falling off a cliff or being moved from one team to the next team, or to one service or to the next service.
Thank you very much, Tina. Do we have any other questions, or are we wrapping up? I think we've probably overused your time slightly already, Tina, but thank you very much. It's been really, really interesting, really informative, and it's great to hear about Worcestershire Children's First.
No worries. Thank you. Thank you so much for inviting me. Thank you.
Thanks.
Bye.
Bye.